Right. Well, welcome everyone. It's so nice to have people in the library again for programs. Thanks for joining us for our program on dementia and challenging behaviors. This is part of our year-long series on dementia awareness in support of the Dementia Friendly Orland Park initiative. I'd like to welcome our speaker, Aishling Dalton Kelly, CEO of Aishling Companion Homecare. Aishling is a certified dementia practitioner, and her agency offers a variety of dementia education classes to the public, caregivers, and healthcare professionals. We're very happy to have a live audience back for programs, and we also welcome those of you who are tuned in on Zoom. We will have time at the end of the presentation for Aishling to answer questions from the audience here. For those of you in Zoom mode, if you have questions as we go along, feel free to type them into the Q&A area or the chat section. And again, we'll ask Aishling to address those after the presentation. And now I'll turn the program over to you, Aishling.
Okay, great. Thank you so much. So welcome everybody. And we're going to keep this informal because I'm an informal type of person. So instead of you looking at me as your presenter, I want you to look at me tonight as your tour guide. So we're going to go on a little journey together and we're going to learn stuff tonight. It's important for me that everybody leaves here knowing more than you did when you came in here. So at the end, there's a quiz and you have to get 100%. So let me just say a little bit about our presentation tonight. It's called Challenging Behaviors. And we're going to kind of take a deep dive into what exactly challenging behavior means and for who. So if you look at the screen, I want you to look at the pictures that you see up there. And I want you to start on the left and kind of work your way around in a clockwise motion. And I'd like you to use your eyes and tell me, just in looking at the pictures, what sort of challenges do you think those people are having? Anybody like to give a frustration? Where do you see frustration in the first picture? He's pulling his hair out, right. And what about in the next picture with the lady with the gentleman in the chair? Yes, he is, yes. He looks very vacant, doesn't he? How about down in the right-hand corner with the, looks like a nursing student trying to give the patient some medication? What do you see there? She's not having any of it by the looks of things, right? Right. And then in the middle, you have a very happy young lady and a senior. There's lots of smiles. It doesn't look like there's any sort of issues there. And how about on the far left? What do you see? Anger. Okay. So there's a lot of non-verbal communication that needs to be brought into play for the cognitive fine caregivers when you're taking care of folks that have a form of dementia and most especially challenging behaviors. And an easy way to think about that is to look at your body. We have two ears. We have two ears for a reason. Anybody like to guess what that reason is for? It's to listen twice as hard, right? And then you're given two eyes because you have to look and then look again. And then we're only given one mouth. And the reason for that is that when you are taking care of somebody with dementia, you need to be really listening really hard. You need to be watching and observing. It's not always as it seems when you look first. So you got to look a second time. And then whatever's going to come out of your mouth, you really need to think about it before it comes out. Okay. All right. So let's begin. And we're going to talk about understanding the challenges. So our objectives tonight is that you understand really what challenging behaviors are and why they surface. And then we're going to talk about specific behavioral disturbances versus aggressive behaviors, because there is a difference. And then I want you to be able to recognize the risks associated with you, the caregiver, if indeed you are the caregiver, because caregiver burnout when taking care of somebody with dementia is huge. And it's a very important thing for a caregiver to recognize burnout and ask for help. So I'm not psychic. When I was growing up, my dad used to say I was a jack of all trade and a master of none. I'm definitely not a magician, but I would guess that most of the people that are listening here tonight or that are here in person are here for one of three reasons. One is you're here for more information, or information that you can't find, or resources. I guess the second reason is because you either work with folks who have dementia, or there's somebody in your close circle of friends with dementia, or that you have nothing better to do on a Friday night. So it's one of those three, right? Okay, well, the folks sitting at the back of the room there, we need wine at the next presentation, please. Oh, she's taking notes. Okay, good. All right, so let's examine what is challenging behavior. Any thoughts on what a challenging behavior would be? Think back to the first picture that we saw. What, in your opinion, can somebody give me what they would think would be a challenging behavior from anybody, not necessarily even somebody with dementia? Well, let's look at it this way. And before I say this, I just want to preface it by saying that people with dementia are not like babies, nor should they be treated like babies. But for the purposes of example tonight, I want you to think about if you did have children when they were young and maybe they had, they were overtired, maybe they didn't get their own way, what would happen? They would kind of act out, right? Maybe have a temper tantrum, things of that nature. That's what would be called a behavior, or a temper tantrum, which would become challenging both for you and for them, right? I'm sure you've seen sometimes a mother is trying to restrain their child in a park or in a grocery store because they're just gone AWOL. That would be a very challenging behavior for both parties. So the actual definition of a challenging behavior is something that happens over and over again. I call it like the hamster on the wheel. It keeps happening, right? And when it keeps happening, this is where we need to watch and listen, because there's usually a reason for every single behavior. Behavior doesn't just happen all by itself. There's a lead up to it. So a challenging behavior is when it interferes with the learning or the progression of social interaction for any adult on a daily basis or a recurring basis. So why is the term challenging behaviors used, right? Now, in the background, at the moment, there's a kind of a movement that's going on that is looking to change the language that is used when we're taking care of folks with dementia. So probably in a couple of years' time, you won't even see that word behaviors. It will be replaced with expressions. So challenging expressions, because they're trying to express themselves with cognitive deficit. Only we as cognitive people are calling it a behavior where it may or may not be. So you're going to see that word disappear shortly. So the question is, does everybody with Alzheimer's experience challenging behaviors? What do you think? Yes? No? Not sure? At some point. Okay. And we're going to take a little deeper dive into this as we move ahead. But just before I go to the next slide, does everybody understand that it isn't just all Alzheimer's? Do you understand that there are different types of dementias? Did you understand that? So I know that folks cannot see me that are on the webinar, but I always bring this because I'm a visual learner, and I try to bring this to break it down for people to understand, because a lot of people think that Alzheimer's is the only dementia that's out there, and there's not. Some people say there's up to 300 different types of dementias. However, if you think of an umbrella, just like this one I'm holding, as being an umbrella term, so dementia is the umbrella term. And then underneath that umbrella term, you have the typical types of dementias. Now on this umbrella, obviously I have several. So to break it down, I will tell you that Alzheimer's dementia is the most prevalent form of dementia, and it typically carries 60 to 70% of diagnoses. So most people do have Alzheimer's dementia. However, as you'll see, there's frontal temporal dementia here. There's CDJ, which is Creutzfeldt Jacob's disease, you have PICS, you have Huntington's, you have Lewy bodies, and you have vascular. Those are the ones that would go underneath the Alzheimer's dementia and carry lesser percentages, okay? And when we're going to talk tonight about challenging behaviors, when you see that Lewy bodies one and frontal temporal dementias, both of those carry high repetitions of challenging expressions. It's because of the type of dementia that it is. Does that make sense? Okay. All right, so there are some people who remain pleasantly confused the whole way through. And those folks are basically the folks that have a form of dementia. So for example, my mother had dementia, but she had Alzheimer's dementia, and she was quite agreeable the whole way through her 7.5-year journey. Did she have instances where she was combative? Yes. Did she have instances where she didn't want us to give her a shower? Yes. But she didn't have what I would call tough sessions every day. Whereas we'll say folks that have a form of Lewy bodies, that's a much more challenging one. So yes, you were right, Elena. There is patterns of disturbances here and there intermittently, but for the most part, not that anybody would want any form of dementia, but if it was the Alzheimer's one, that's the more favorable one because they're pretty pleasant and they just kind of carry on. Does that make sense? All right, so Alzheimer's is the disease that affects the brain, and the brain is what controls our behaviors. So it follows that just when our thinking and our memory are affected, so too are our behaviors. Many times, and I brought a little magnifying glass over there as well as a visual for you, many times as the caregivers, we have to become a Columbo. Does everybody remember Detective Columbo? You have to become Detective Columbo because you need to get to the root of where this challenging behavior stemmed from. So there's 3 types of factors that cause challenging expressions. One is the physical cause. So again, think, for example, if a baby fell and hurt their knee, they're going to start crying, right? Because they've hurt their knee. The other one is cognitive causes. That's where the deficit becomes. And then there's external causes as well. And we're going to break these down a little bit more. So let's look at this picture here. And we'll say this is a senior in his 80s. And he has physical causes. So what might those physical causes be? Well, maybe he has a sore foot, but he can't verbalize that he has a sore foot. And maybe his daughter tried to put on a pair of shoes that are too small for him. He's been in them all day. So there could be a behavior because he doesn't know how to express that his foot is bothering him. So that could be any sort of discomfort. It could be somebody that has a soiled undergarment. It could be somebody who didn't sleep all night. It could be somebody who has arthritis. They're all physical reasons why somebody might act out or have a physical expression or behavior. Then you have what's called the psychological cognitive causes. And that's where potentially there may be overstimulation. An example of that would be, I hear so many families say, my mom or my dad don't want to be around the family anymore. They don't want to go to family parties. Why is that? What's happening? They always used to love being around the kids. Well, if there's a form of dementia and it has advanced, sadly, when you take somebody out of their routine, they don't like that, right? Because they're kind of knocked off kilter. And then the other piece is too that everybody in the room could be a stranger to them, or indeed that they don't remember their names and they know they don't remember their names and they're embarrassed. So there's a little bit of paranoia there as well. So that's can be also if they're at a ball game, maybe outside, that they've gone to some sort of an event and there's too much noise. There's too many children screaming. There's too many other things, too many kids running around. Things are moving too fast. They're all extra stimulus that affects people that have dementia. And then you have the external causes, which again causes confusion and or paranoia. So at what stage do these challenging behaviors occur? Does everybody understand that there is different stages or phases to dementia? So typically, not that it's a nice story, but we are in the library. So I want you to think about the fact that there are 3 stages to dementia. Now, there are other doctors that have come forward in the latter years and have said that there's other stages. I will say that all you need to remember is that there's 3. There's the beginning, there's the middle, and there's the end. Like I said, some doctors have said there's 7 stages, and then there's another doctor more recently who said there's 14. It doesn't really matter how many stages they are, because you as the caregiver are the one who has to deal with all the challenges on a daily basis. And there is no light switch that goes off that says, okay, we've entered from stage 1, now we're in stage 2. It's very, very progressive, and it happens over time. So in the early stages of dementia, people will battle the memory loss by initiating behaviors that they feel is able to help them control a situation. So, for example, it's not unusual to see someone develop an obsessive compulsive behavior, since routine and repetition are reassuring and can prevent mistakes, okay? And we've all done that, where we're afraid to be embarrassed that we know something that we're used to doing, and we do it well, right? Other people in early dementia will begin hoarding things, and this is very common. And there's 2 reasons for the hoarding. One, because genuinely they have forgotten that they already bought it, or there's a fear of never having enough, so you buy excessive. As the disease progresses in the middle stages, individuals, of course, feel more anger and aggression and agitation. Now, if you understand what happens with dementia, people's brains are breaking down every second of every day. So it's like trying to cross, we'll say, a bridge from A side to B side, but the middle section is gone. How do you jump from one side of a bridge to the other without that connection? That's what's happening with dementia. And as it advances, the breakdown gets more. It's more and more impacted with the person's brain. So they are not able to remember as well, and it keeps building because it's progressive. That's in the middle stages, and this tends to be the most difficult stages in terms of behavior, since the person's ability to reason or logic has declined. And this is where the frustration begins, really. It actually begins in the first phase, but in this middle phase, it's more aggravated because they can't communicate with you. So they get frustrated with themselves. And of course, then the ability to speak goes as well. So that's another piece that people have to manage. They also might experience some psychological behaviors such as hallucinations or paranoia, which again are very distressing for both the caregivers and the person that has the dementia, because they actually believe what they're seeing, but you can't see what they're seeing. So that is 2 different conflicts right there. Now, I had mentioned earlier that Lewy body's dementia is one that carries those hallucinogenic thoughts, and that's a very frightening dementia, and it's even probably more frightening for the caregiver. Because what a person sees when they have the Lewy bodies is very real and very frightening. And what you see then on the caregiver side or the spouse side, as she spends her whole time explaining to the husband who has Lewy bodies that there's nobody there. So in essence, the 2 of them are going around and around in circles, and none of them are getting anywhere fast. So that becomes very frustrating, and it does escalate and can escalate. And if you haven't seen the lead up to these presentations, the library has them all recorded. So you can go back onto YouTube and you can see where we start to analyze what's happening in the brain first. And then we've brought it to the second educational event and the third. And now this one is the 4th. So you will be able to go back. I'm not sure how long the library is leaving it up there for, but all year. Okay, fabulous. So if there's folks that are listening at home or folks that are here today, and this is a lot of information, which it is, just know that you can go back and it builds up to where we are today. So in the latter stages, this is what I always call the quiet phase. So if you're to ask my opinion, I think the second phase is probably the most challenging, or the stage 2, the middle stage is the hardest part for the caregivers. Certainly in stage 3, this is where things start to get a little bit quieter. It's almost like the fight is gone out of the person because they're just not really able to do anything anymore. They start to withdraw, they become very depressed, and of course it's more difficult to elicit a response from them. In late Alzheimer's, individuals do usually require more physical assistance from you in their activities or daily care, but just display fewer challenging behaviors. And this is where you, as the caregiver, literally are providing 24-hour carers for somebody like that, because you need to be watching them, preempting every move, and being there for everything that they need, because they can't at this stage verbalize really what they need or what they want. So now let's have a little look at these pictures again. And again, the unspoken words here, you can see the body language and the expressions. You look at the picture on the left. I'm not sure which one of those folks has actually the dementia. It looks like her husband, but you can see that the lady is very down herself. You can see that her eyes don't have any sparkle and she looks totally fed up. Dementia is really, really hard on the caregiver, every bit as much as it is on the person that has it. And if you look at the picture in the middle, same situation. The lady just doesn't seem to be engaging at all. And then on the right, you have somebody who's got his fists clenched really tight. He's ready for battle. He's not taking any nonsense at all. And then you have what looks like to me on the bottom, on the left-hand side, a spouse who's trying to explain to her husband what she wants him to do. And that can be very frustrating as well. And we're going to talk a little bit about that. This gentleman in the middle, he looks to me like he just wants to be left alone, 100%. And then over there on the right, that lady looks like she's managing quite well. At least there's a beautiful smile off her. So when we talk about these challenging expressions, challenging behaviors, what sort of things are we looking for? So if you look at our list here, that's a whole laundry list of all the different things that can happen. You do have aggression sometimes, not always. You can have anger, again, sometimes, not always. Apathy or disinterest is where folks that have this dementia kind of digress inside in themselves. It's almost a lack of interest in life, and just in general, they're just not engaging. There are changes in personalities. That's one of the big things people notice kind of in stage 1, that things just aren't the way they used to be. Of course, there's communication problems because there's pieces of their brain that are dying off every day. So things are just not connecting the way they should be. Sometimes you see people that have dementia following their caregiver or their spouse around the house all the time. That's almost an insecure thing. They don't want to be left alone because they could be paranoid. You have mood swings. This is very, very typical. Most especially in the middle stages, there's a lot of mood swings. You have nighttime walking and pacing. You need to remember that the nighttime walking and pacing, it can be just part of dementia. Secondly, it can be that there hasn't been any activity for that person or fresh air throughout the day. So in essence, their brain isn't tired because they haven't used it. Right? You and I are using our brains every day. We're thinking, we're trying to map out where we're going from A to B when we're driving. We're trying to maybe make lists of things we need to do in the house. A person with dementia, their brain isn't half as active as ours. So lots of times they're just not tired. And yet what do we tell them? It's time to go to bed. It's nighttime. It's time to sleep, right? Sometimes there's physical and hitting, and also restlessness and verbal abuse. Now, let's just talk about that verbal abuse, because I can tell you that my mother was a lady and she never used the F word ever. But I can tell you it was pretty frequent when she had dementia that word came out. And let me tell you, she knew when to use it and where to use it for maximum impact, which was quite embarrassing. But at the same time, we see that today and people get all bent out of shape. If you understand the disease, you understand that it is part of the disease, and you don't need to necessarily make an apology for the person. They are trying to express something to you, and you need to listen, and you need to listen hard, right? So again, think about those 2 years, right? So how do we handle these behaviors? Is there any sort of tips for caregivers for agitation, and what do we do and when? How do we deal with communication problems? How do you deal with delusions, hallucinations, and paranoia? How do you handle somebody who has sleeplessness and sundowning every day? How do you handle wandering, right? So when I had said to you before we began tonight that you as the caregiver, if indeed you are the caregiver, you have the toughest job in the world. And this disease it's brutal. It's depressing. It's really sad. It's a challenge for families in addition to the person who has it. And it is relentless, and sadly, it's progressive. But what I will tell you, that if you're not prepared and you don't know how to manage all these basic things, it will be caregiver burnout if you indeed are the caregiver. So now we're going to talk about, how do you communicate to others that you need help? And when do you recognize that you need help? Because you are going to need help. I'll also share with you that I'm from a very large Irish family. I'm actually the youngest of 10 daughters, and 10 daughters plus one other outsider for 7.5 years took care of my mother round the clock. So when I tell you it takes a village, I'm telling you it takes a village. So you need to surround yourself with those that are going to help you and understand, and with those that will actually give you some sort of respite. So who here asks for help on a regular basis? Are we good about asking for help? No. You are? You're good at asking for help? Well, I know I'm not, because I'm fiercely independent. And I know we have 2 gentlemen in the room here, so I'm not going to say that we're that different. But I can tell you, women in general just think they can do it all. We think we're super mom. I don't know if we just want to be super mom or what, but I know when people ask me, can I help you? I'm like, no, I got it. Thanks. And maybe we do. But when you're taking care of somebody with dementia, there's going to be a stage where you're not going to be able to do it alone. So asking for help is very, very important. Sometimes you're going to try and understand the behavior and maybe accommodate it, but that depends on the situation, and it depends where you are. There might be things that you can accommodate perhaps when you're in your home, but maybe the same situation out in a restaurant might be something that you can handle. So you have to learn the ways to kind of pivot and balance. And we're going to talk about that in a minute. As I had said when we started here earlier, there's a reason for every single behavior. So you have to learn, where is it stemming from? And that means that you have to be smart enough to kind of keep track and look at where things start and where they end up. And is there a pattern? And then you need to identify, how do we figure this pattern out and how do we fix it? Changing our perspective. And again, I'll give you an example, and this is not to be disrespectful to the daughter who said it to me, but she said to me once, Aishling, my mom and I never had a good relationship, and she just goes out of her way to annoy me. How can mom forget where the knives and forks are when she has set the table for 40 years? And she said, I have to ask her, and 5 minutes later, she asks me again. And then 5 minutes later, she asks me again. And I said, so who do you think has the problem? And she just looked at me. She said, how do you mean? I said, your mom can't change the fact that she doesn't know where the knives and forks are, but you can. So you have to change your perspective, because your mother's brain is broken. And yes, she may have known for 45 years where the knives and forks are, but she doesn't know anymore, which is why she said to you, what am I doing? And you have to answer that question. They're in the drawer, mom, as if you're answering it for the first time, even if she asks you 15 times. And you have to answer it with the same tone of voice, which is very hard. It's very frustrating. But if you don't do that, you'll drive yourself nuts and you will burn out, because you're going to get angry, right? After 3 or 4 times of saying where the knives and forks are, your tone of voice is going to change, don't you think? Your fist is going to start clenching, right? You're going to bang your fist into the wall or do something because you're tired saying the same thing. But you, as the cognitively fine person, are the one that has to change your perspective, because the person that is looking at you cannot. So coping strategies. Well, isn't that fun, Aishling? How the hell do we do that, right? What if you don't have as much help as you would like? What if you don't have family that's living nearby? What if you don't have a resource of friends or neighbors? This is where you need to, when things start to develop with dementia, that's when you need to put the resources around yourself, not when you need them. So I call that being proactive versus being reactive. And God forbid you don't have any help and you're stuck at home all day and you don't go out with your wife or your husband because of different things that happen and you don't want maybe the neighbors to know, or for whatever reason. I've heard every reason in the book, so nothing would shock me. Then you need to figure out something that you can do to relax while stuck at home, even if it's maybe music or watching television or exercising. You do need to learn to disrupt the patterns, which can help to change negative behaviors. Employ compassion, flexibility, and patience. And let me tell you, if you're the caregiver, again, a sole caregiver or one of the caregivers taking care of somebody with dementia, you have to do it for the love of the person that you're taking care of and understanding, because your patients will be fried because it's challenging. It's very challenging. So again, the folks that have the dementia can't change their behavior. So then you're going to have to take a deeper dive at what you can do yourself. All right, so keep in mind, although you can't change your loved one's behavior, you can always change your own. And that's so hard, again, for you as the caregiver, because you're trying to balance the person that has dementia. You're trying to run a normal life. You're trying to keep things as normal as possible. Somebody's asking you possibly the same question 500 times a day, and then you have to do everything for them as well. That's a lot. That's a lot to have to cope with. Realize that when you try to control the person's behavior, it must be met. It might often be met with resistance, and you may have that as well. And this is where we're going to learn, how do we manage your own anger, and how do we get the person to do what I want them to do, even though they don't want to do it. And again, that's a technique, it's a skill, and it doesn't come easy, but we do have to learn that. And remember that behaviors are motivated by something. They're always motivated by something, and it could be something from the day before or from the night before. It might not necessarily be something that happened 5 minutes ago. So how do you handle agitation and anxiety? So in any situation where somebody becomes anxious, you need to kind of, again, look at what's happening at that time. And how can we reduce anything that's causing that anxiety? So for example, if you were at home at the dinner table and you have a lot of kids, adult kids, and they all come over and they're talking very loudly, that might be a situation which might cause your dad or your mom or whoever has the dementia to kind of get all anxious and fidgety. And then you look at that situation around the dinner table, and then maybe time for your sons or your daughters to maybe speak one at a time instead of speaking over each other, or just to be a little quieter, right? You have to look at that. Or potentially, is the television on, or is there a sports game? And is that enhancing the conversation? And is all of that volume escalating the anxiety of the person? One of the things that's really important for folks that have a form of dementia is routine. Again, I'm not saying that they're like babies, they're not, but think about if you have children, anybody that's at home or anybody that's sitting here that has raised your children, it's very important that you have a familiar routine. And here, with moving things around the house and changing things, that is quite upsetting for somebody with dementia as well. So be very careful that you kind of leave things in the same place, because there's changes going on in their brain. And potentially by moving something, you could actually cause them to fall because they were used to it being there for 40 years and all of a sudden it's gone. Play soothing music. Now, this is one of, there's great therapy on that. And this music therapy could actually be a whole educational event all by itself, because music does work. And the reason music works, of course, the person who has dementia would have had to have always liked music first, But the reason the music works is because your short-term memory goes, which is why I can't remember what somebody said 5 minutes ago. But the memories that have been stored from years ago are the last ones to fade. And usually this generation will say that has dementia, they were great for going to the dances. They had the big blues bands, Nat King Cole, Frank Sinatra, all of those very famous singers. People listen to those singers on the radio, and they watch the movies with Doris Day and Betty White and all of those people who were great singers and actresses. They remember those, and it's connected to emotions that they also have in their brain. And it's stored in an area called the hippocampus, which those memories are there for a long time. So as a person with dementia loses the more present and current stuff, their mind goes further back over time. And it's almost like the brain fetches back into those emotions. When you hear a song or you play a song with music therapy that they recognize from that era in their life, we'll say between 14 and 25, it just brings a whole peacefulness to them, whether it's classical music or hard rock or whatever it is that they wanted. There is amazing science behind the science of music and memory. And you can actually use music to diffuse a situation in the sense that if you see that somebody at 5 o'clock every day is starting to sundown, which is it's very regular that people sundown at 5 o'clock. By introducing music that you know they love at 4 o'clock and maybe having them sit in the chair and you put that music on for them, you're probably going to bypass that whole 2-hour situation where they're going around the house and they're trying to exit seek, because the music will take them to a different place. So it makes them very calm, it makes them very relaxed. And in addition to that, they're just resting, they're very peaceful. And it also buys you time to maybe do your chores in the garage or whatever. So music is huge. So think about that if you do have somebody who has a form of dementia, whether it's Alexa that you have, or Siri that we have today, or the iPods or tape recorders, even the radios or CDs. Put those on because they will help you. And then safety proofing the environment is very important. The more a person goes down their journey with dementia, the things that you think they would never put in their mouths, they probably will. So you need to be very careful because the recognition goes. For example, the beautiful Tide Pods that we have today that are lovely blue, white, and purple, they look like candies, right? So again, you wouldn't let a 2 or 3-year-old walk freely in the house with those available on your laundry floor. You also have to think that way, not because the person with dementia is a baby, but because their cognitive function is declining and they're just not able to recognize danger. So you have to be their eyes and their ears, and you got to be their advocate. So you got to think about all of those things to safety proof the home. So this is stuck. It's frozen. So for those that are listening, we have like a little technical glitch. We're just going to try and fix that for you. Does anybody have anything, any question that I can answer before we move to the next slide on anything that we've done so far? Makes sense? Right? Just a show of hands, people that are in the room. Are you here because you have somebody in your circle or somebody that you know? Yeah. Yeah. So that's, yeah, half the people, and myself too, of course. And Elena, you can put your hand up too. So that's 80% of people in the room. So this disease is very, very prevalent. All right. So the number one tip I could give you today, and I need you to write it down. You're never, ever, ever, did I say ever, never going to win an argument with somebody who has a form of dementia. So just don't even go down that road. Okay, because you're dealing with somebody who can't rationalize anymore. They've lost that ability. Okay, so by you understanding that, I've added years onto your life already here today, because you're not going to get anxious and your temper is not going to go off the rails. You just have to take a deep breath and walk away. You certainly can consult with a healthcare provider to find out if there are medications that can help you. And I'm not suggesting that because somebody is argumentative that you run to the doctor and say, give me, medicine to try and calm them down. That's not what I'm saying. But lots of times there are things that can be done to help a situation. Like, for example, if you did have a mum or a dad that is up all night, every night and not sleeping, well, you can't do without your sleep, right? Because you still have to go through the next day. In that case, you absolutely could talk to your doctor and say, my parent is not sleeping and I can't function without my sleep. They're not taking a nap during the day. Is there something that we could maybe, or could you prescribe something that would help them relax around 7 o'clock and maybe put them maybe into a sleep mode? That's when I say there the use of medication might be useful. It also works the other way, that you need to be doing a med reconciliation or have your doctor do it, because lots of folks sadly are on too much medicine and one sometimes is contradicting the other. And that causes them sometimes to have a challenging expression, communication, and or not sleep, or various other things. So you need to be keeping track of everything. Don't feel the need to play into a lie. You can be honest while still providing dignity and respect. Again, that's a very broad thing to say. It depends on specifics. I think what's important here is that when somebody is having an episode or they're being very verbal, I think the best way to respond is to validate that you've heard what they've said, in saying, I understand you're upset. I feel that you're anxious, and you be the bigger person, but you always have to recognize what they're trying to tell you. Always, because if you don't, it'll go the other way. Always reassure the person by saying things like, I'm sorry that you're getting upset, or I'm sorry, that you're having a bad day. I'm sorry that you're so angry. Again, validation of what is going on. And redirectional skills, that is so important, but nobody knows how to redirect people with dementia, right? Lots of people just turn the other way because they just don't know what to do. So they figure, well, I'll do nothing. That's the wrong thing to do. Redirectional skills is in actual fact a skill. And when you start doing it, you will end up being a master of it. And practice makes perfect. If something you tried today works, don't be disappointed if tomorrow you try the same thing and it doesn't work. Then you got to try something different, right? So avoid giving your loved one alcohol. Now, I don't agree with this at all, not because I'm saying they should have alcohol, but again, I'll go back to my mother, was never a drinker, and we didn't necessarily want to have medication to put her to sleep, but we knew that if we gave her a little glass of wine with her dinner, and she wasn't on any other medications, it did actually help her to sleep. So I don't agree with this one in particular, but obviously somebody that's on a lot of medication should not be drinking alcohol. But I would suggest that if your mom or your dad or whoever the person is that you're taking care of enjoys a little beer with their dinner, then why not, if they're not taking medication, because it just might help them fall asleep. Caffeine or sugar? Definitely the caffeine. Lots of people with dementia love coffee, but they can't, again, be having coffee at 10, 11 o'clock at night. You need to be the one, if you're the caregiver, to give them the coffee at 4 or 5, and then you know that that's the last cup of coffee that they're having. And of course, decaf always works as well. Sugar does keep people awake. So again, be smart. Don't take everything away, but just give it in a minimal amount. If you have somebody who is not sleeping at nighttime, of course, you can consider hiring help so that you can get your sleep without having to leave your loved one with dementia unattended. Now, I'll share with you that this happened also in our family, that our mother was roaming the halls every night, and my sister worked during the day, and of course my dad had passed, and my sister was the only one that was in the house until we started helping her at nighttime. So until we could put that plan in place, rather than everybody driving everybody else nuts and standing and sitting in the house when it's, you know, really quiet at nighttime, checking on mom, we actually made upstairs mom's playground. So we took away all the dangerous stuff. We left on the lights in the hall and we gave her all the things in the rummage drawers. So when she opened a drawer, no matter what she touched, we knew it wasn't dangerous. And until we could afford to put another plan in place, that worked. And we blocked off the top of the stairs because we knew she would fall head first down the stairs. So we put all those safety things in place because there was nothing wrong with her walking around at nighttime, right? Telling her to go to bed and to get back in bed would have caused what? It would have caused her to get angry and a fight would ensue. So we just looked at it from a whole different perspective and thought, okay, we have to sleep. So we're going to make it safe for her to go from room to room. And there was nothing that she would have put in her mouth or nothing that was dangerous. So you kind of have to be smart with this disease too. Discourage napping during the day. I would say that there's a big difference between napping and sleeping. So first of all seniors love to have naps, whether you have dementia or not. A nap is a nap. Nobody with dementia should be sleeping 3 or 4 hours a day. Why? Because I already told you they're not necessarily tired at nighttime. And if you let them sleep for 3 or 4 hours, you are going to be up all night with them because they're not tired. The other thing I would say too is it doesn't have to be, you know, a long nap, but see what's right for your person. Half an hour, you're going to have to track it so you know what the perfect time is so that they can still sleep at nighttime. Turning lights on and close the curtains. All right, so I'm sure you've heard of sundowning. Have you heard of that sundowning? So sundowning, for all the research and science that's out there, is they say that around 4 o'clock, 5 o'clock in the afternoon when the sun starts to go down, that people with dementia kind of start to act up. They start to get anxious and paranoid and all that other good stuff. So being smart and being ahead of the disease, if you're seeing that pattern is happening with your loved one at home, then that's exactly what you need to do. You need to set the scene, set the stage so that the curtains are closed, we'll say, so that they don't see that happening. So it's an easier transition for you. Eliminates confusion. So how do you stop somebody from wandering? Now, wandering is a big issue. It's like 50,000 people a year wander in each state. It's a big issue. And I always say to families who say, you know, that their mom or dad has dementia and they're out driving, I say, well, shame on you, because they might go out one day and they just might not come back. So you need to be very careful when you know that this situation is happening, because it may happen like that your loved one could go out and they just might not find their way home. So safety proofing your house is very important, not just the doors, but also the knobs on your cooker, things like that, even sometimes closing the microwave. We had a man once who, in his full-blown dementia, put a cup in the microwave. He remembered enough to put the cup in the microwave and almost set the house on fire during a shift that we weren't there, because he remembered that something he wanted to drink and he wanted to heat it, and there was gold and metallic or something on the cup, and the microwave went on fire, and from there it spread. So it can be something as simple as that. So again, don't have any cups in your house that have that silver or gold on them, right? So that eliminates that problem. But you need to think of these things before they happen, and they may not ever happen, but you're preventing you're just preventing any sort of danger for yourself and for your loved one. Now, as we had said earlier, dementia is here. Orland Park is now Dementia Friendly Village. I don't know if you understand what that means, but for the folks that are listening and for those that are here in the room, I'll tell you briefly that it is a huge network that's going on all around America at the moment. Illinois has actually the most villages. We're at 21 villages in Illinois. So that'll tell you how rampant this disease is. And everybody's jumping on board to make their villages dementia friendly. So here in Orland Park, we are trying to, of course, like every other village in America, we're trying to reduce the stigma of this disease, because we want you to be able to bring your loved ones out in the community. So we have a form here with the fire department and the police department where we're asking you to step forward in privacy, and you can fill out this form so that our first responders know, God forbid there was a 911 call to your house, they already know that somebody on the inside of the house has a form of dementia. So the communication and the response would be totally different based on what we're talking about tonight, because they have to be approached differently or it will cause a huge challenge on the inside of the house. So it's very important that you understand that that's available. And more important is that you understand that a recent photograph needs to be on file, especially if somebody gets out, because a picture from 1947 isn't going to cut it in 2021 because we don't know who we're looking for, right? So it's important. It is something that's there. We're encouraging people to do it. We don't want anybody to be embarrassed that they have dementia or their family member has it, because I'm standing in front of you here today. I'm not embarrassed to say my mom had it. She didn't ask for it. It's the same disease as cancer or anything else, only that there's no cure. So nobody wants it, but we have to help folks who have it. So that's what Dementia Friendly Orland Park is about. And we're going to be doing a lot of things here in the library moving forward, but just know that in any dementia friendly village, it's all about support and resources, because you as the caregiver don't have the disease. You're the one that's delivered the diagnosis, but you are not given any resources on how do you deal with this stuff every day. And that's where the challenge becomes. So they talk here about installing door alarms so that your loved one, doesn't get out. I always say to people, think simple, right? You don't have to go and spend $10,000 on fancy alarm system in your house that when the door is opened, it would scare the dickens out of everybody because of the alarm. Think simple. A little bell from the dollar store that's on a hook, something on a string on the door handle so you just hear that noise. It can be that simple. Locks are required with a key instead of the locks that we have now, so they can't open them. But again, these are drastic measures at the very end. God forbid if these are the things that are going on, not something you need to put in place now, but you just need to be aware of them. So challenging behaviors, as we're talking through tonight, is usually something that surfaces because there's a need in the person that has dementia that is not being met. So be careful observing your person. What comes directly before and after behavior, the caregiver may be able to determine the underlying need and learn how to alleviate the challenging behavior. People with dementia need to be treated with kindness and with the knowledge that they can still enjoy life. And that actually is the whole mission of Dementia Friendly Orland Park and all these other villages around the country, because we want our residents to be able to go out in the community with their spouse and to work in and out throughout the community as they have always done before. All right, so if anybody has any questions, it's, yes, young man. Well, there are. So the question was, for those that didn't hear it, we have a young man here who came in late and he wants to know if Alzheimer's, is it always Alzheimer's, or are there different types of diseases? So how I'll explain it to you is that there are all different forms of dementia. Some people say there could be up to 300. Alzheimer's is one form of dementia. So if you have Alzheimer's and you're being diagnosed with it, you have a form of dementia. However, if you have dementia, it doesn't mean you have Alzheimer's. It could be a different type of dementia. Yes, they can. And there's a slew of tests. There's the basic tests that your doctor would do as a workup to even determine what's going on. Urinalysis, there's like a slums clock test. There's all sorts of basic tests. But if you want 100% diagnosis of a specific type of dementia, then you have to go a lot further. You have to see a neurologist, and they would run all sorts of imaging tests, ultrasounds, very expensive tests, but they do run them. In actual fact, to be quite factual, a diagnosis of Alzheimer's can't actually be determined until the person is dead. Would you believe that? Yeah. I don't know that there's specific data, because really, how would you know if the person takes their own life? Why did they take their own life? Was it because of that, or was it something else? I think there's a lot more awareness today about dementia that's out there. I think if people truly understand what's happening and they have a plan in place, I definitely think that would prevent somebody taking their own life. Have people taken their own life that have had dementia? Yes. Yeah. Right. Was he diagnosed as having a form of dementia? Right. Right. So yeah, it is. It's possible. I'm not going to say it's not. It is. It most definitely is. Do we have any questions? Yes, Elena. Yes. Right. So for those that are listening online, I don't know if you heard, we have an audience member here named Elena, and she was responding to the question of the gentleman who just asked if there was any research on folks that have dementia that take their own lives. And Elena was saying that when a person does have either a diagnosis of dementia or the family diagnosis, the person themselves, that is where the education needs to come in for the family members, because there's no point in getting frustrated and getting mad. What needs to happen is education and resources so that you can actually put a plan in place. Any other questions? Well, I must have done a fabulous job then, because nobody has any questions. Well, I just want to say thank you so much for coming tonight. For those that are listening online and for those that are here, there is a support group the second Monday of every month. And we're going, that's at the fire district located on 151st and LaGrange, where Station 1 is. That is ongoing the second Monday of every month at 7 o'clock. And then the library and myself and the fire department are going to be working to have another support group during the day here at the library. I don't remember the dates, but I think that's going to start in September, right? Okay, so we're going to be offering a daytime support group, which will also be the second Monday of every month. And that support group, for those that are listening and those that are here, that support group is for caregivers. So that's for not for the person that has a form of dementia, that's for you. If you need to come and get resources or just come and take a breather, take a break. The one here in the library, I think is going to be at 1:30. Am I correct? I think it's 1:30. You'll see it. It will be posted online. And then the one in the evening is at 7:30. So 7:30 in the fire department and 1:30 here in the library. And both are on the same day, which is the second Monday of every month. And there's great resources around you. So don't ever feel like you're marooned on an island. You're not. You're amongst people who understand what's going on, and it's more prevalent than people let on, which is, again, the whole purpose of this venture. So the one that is in progress now is the nighttime one. So this Monday at the fire district, and every second Monday of each month, it's there. The one during the day, we're going to be starting in September here in the library. So we have another, what are we now, July? So another 2 months, we're starting it here. And what we're doing is we're training some of the folks here in the library to be support group leaders. And then when we have more support group leaders, we'll actually have more support groups because we've identified that it's needed. So, any other questions? All right. Well, thank you for listening, everybody, and I hope you have a super weekend.
Thank you very much, Aishling. Good night, everyone.